Over 750 current and former Department of Health and Human Services workers are calling on Secretary Robert F. Kennedy Jr. to stop spreading inaccurate health information.
They're also calling for RFK Jr. to do more to protect public health professionals in the wake of that shooting at the headquarters of the Centers for Disease Control and Prevention earlier this month. The staff members say the attack on August 8th was not random.
For more on this, we're joined this morning by two people who put their name to that letter. Abigail Tai, a founding member of Fired But Fighting, a coalition of terminated CDC employees and public health allies, and Dr. Ian Morgan, an NIH scientist and the steward of NIH Fellows United. Thank you both so much for joining us this morning.
Thank you for having us.
Ian, let's start with
you for this opportunity.
Thank you. Let's talk about the genesis of this letter and why you felt compelled to write it. Ian, we'll start with you.
Sure, yeah. Well, I think it became very clear after the several months where we've just had rampant disinformation and misinformation coming out and about vaccine technology, and also huge impediments at places like the NIH in our ability to do the life-saving research that we need to do to make Americans healthy. I mean, we saw the administration, we saw RFK Jr. go on and talk about how they really wanted to make Americans healthy by doing things like, making healthier foods available, by studying new things like nutrition, by studying, all kinds of these various things that affect Americans. And our jobs at the NIH, our jobs at the CDC and across HHS are to be able to do that. But when you put roadblocks that make it so scientists can't actually get the resources they need to do their work, that can't actually, when you're actually firing us so that we can't actually do our jobs, we've seen that happening. And then we just are then being kept from being able to publish certain things. That makes it really difficult to do our works, and that makes it difficult to do our jobs. And now we see this shooting that happened at the CDC that should have been a wake-up call for HHS leadership. And instead, what we've seen is RFK continue on. We saw recently the divestment of $500 million from mRNA vaccine technology, which is the greatest thing in the last century in technology. I mean, the mRNA vaccines have already saved more lives than seatbelts. And so funding more of mRNA vaccine technology should be a no-brainer, like wearing a seatbelt. So with all of that coming out, with the shooting and with people continuing to frankly paint a target on our backs, it was imperative to write this letter.
Abigail, can you talk to that a little bit? Not just what you think this is doing to health for all Americans, but the idea that you believe a lot of this sentiment about health workers in general helped foster that shooting.
Absolutely. So I think that the consensus among many of us at CDC and in the public health space and at HHS broadly feel like we cannot go into our offices to work and cannot even tell people where we work without potential violence. And I think that part of that is because, Secretary Kennedy has explicitly said things that villainize federal workers and especially his own workers. I mean, he is our boss, and he is, gladly going out and doing interviews and spreading information about us that is just not true. I mean, we are people just like everybody listening to this, and we are passionate about something, and that something is helping the American people. And I think that we feel like we're at a point where no one is listening to us, no one is protecting us, no one is worried about our safety, and they should be. We are federal workers. We are part of the government, and our government must protect us. Our leadership must protect us. And I think a lot of us feel like we're at a point where we didn't know what else to do. So writing this letter and asking RFK Jr. to please stand up for his employees and please stop making our jobs harder and stop, like Ian said, painting targets on our backs. It's imperative. And if Secretary Kennedy can't do that, then it's up to Congress and the White House to step in and help make sure that leadership is protecting these workers.
So HHS has responded to the letter that you both have signed here, saying, quote, Secretary Kennedy is standing firmly with CDC employees both on the ground and across every center, ensuring their safety and well-being remain a top priority. He goes on to say any attempt to conflate widely supported public health reforms with the violence of a suicidal mass shooter is an attempt to politicize a tragedy. Ian, the coworkers that you talked to, are any of them who maybe signed this letter afraid what this means for them professionally? Do you know anybody who didn't sign the letter because they were concerned about what it might mean for their job security?
I mean, first off, I'd just like to talk about that. I mean, it's really disappointing when you have leadership where you bring concerns to that they completely discount you. I mean, that's gaslighting. RFK and the HHS is gaslighting us. And that's frankly a problem. When you have workers whose jobs are to bring issues to you, to help inform you about what needs to get done to make Americans healthy, right? You should be listening to them. Right now, RFK Jr. and HHS leadership are making Americans sicker. And if they're going to continue to make Americans sicker, it's our job to then go to Congress and the White House to help make Americans healthy. On the issue of whether people are nervous, yes, of course. I mean, I talk to people every day, and we've seen low morale across HHS. We've seen people who all agree with the sentiments but are scared to speak up about it. But the thing is part of writing this letter, part of going through and talking about these issues means that we can talk to our coworkers, we can give them a space, we can bring issues that everybody's facing into the spotlight so that not just bringing to leadership that aren't going to listen to us, but that we can bring this to Congress and the White House so that they can know and the American public so they can know what's happening to make America sick. Our jobs are making Americans healthy. Let us do our jobs. When public health workers are not safe, we can't make Americans healthy.
Abigail, the U.S. has been a leader in scientific research for many, many decades now, especially when it comes to health research. There are a lot of people in this country who applaud what RFK Jr. is doing. They like the fact that he's really been pushing back on vaccines. From your perspective, working as a part of HHS, what do you have to say to them?
I think that part of this is just the general result of an overly polarized kind of society in which we're in. But the important thing that I want people to know is that we all want the same things. We, I'm a mom. I'm a wife. I have a family. I have people I care about, and just like everybody else in this country, I want to live in a place that is safe. I want to live in a place where I have access to healthy foods and sidewalks and a safe workplace. And nobody wants to live in a country or in a community where they are unhealthy. It's just not, it's not something that humans or people in this country want. So I think that my ask is that folks can recognize that the core value here of helping people and working to a better country and better communities is there. I mean, people who work in public health do this job because they're passionate about that. And while we might disagree on how we get there, we have to make sure that the processes and the way in which we ensure that Americans are healthy is that we follow science and we follow a process to get to truth. I mean, having opinions is fine, but we can't root policy in just opinions. They have to be driven by truth. And science at its basis is the search for truth. And while I know it's frustrating that we continue to have health problems in this country, I mean, we know from the public health perspective a lot of what those root causes are, and we are happy to work with, Secretary Kennedy to get to those causes. But villainizing us and ignoring us and not allowing us to do our jobs is not going to make America healthy. If anything, it's going to set us back decades. And
Yeah.
I just would really, really implore people to recognize that we all want the same thing. And the way we get there might have to be a discussion, but we can't have that discussion if people think we're evil.
Yeah, Abigail, thank you so much.
Yeah, Dr. Ian Morgan, thank you as well. We appreciate both of you providing insight today.